I've shared a lot of these thoughts before, but I just kind of want to summarize a few things that in a profit-driven medical system that we have in the United States, there is no incentive to treat chronic illnesses effectively, let alone cure them, right? And so many of these chronic conditions that have risen and just popped up and risen at just alarming rates since the 60s, 70s. They're really poorly researched. The cause just eludes medicine, but the research the lack of research interest when these are all skyrocketing, well, that's alarming. And the lack of effective treatments, that's alarming. And most of these conditions are highly stigmatized. Well, that's alarming. Okay, and most of these conditions, the patient is blamed rather than the medical system being at fault. Well, that's alarming. And then, well, on the mental health side, well, mental health conditions, many of them, especially the difficult chronic treatment resistant kind, well, they don't result because somebody's mentally weak. Most of these result because the person has an undiagnosed underlying pathogenic cause or some sort of biological cause like neuroinflammation, brain inflammation, right? That's chronic. So, and then people don't respond to, they go on the carousel merry-go-round of various psychiatric medications, from the various kinds of antidepressants, from SSRIs to SNRIs to, whatever the flavor of the du jour is, and then, and now antipsychotic medications are woven in, and for people with treatment-resistant depression or bipolar depression, when they don't have hallucinatory or delusional, they're not psychotic, okay? And then, and all of these medications, they come with terrible. I hate the word side effects because that underscores it. Consequences, guys. Consequences. All right? Where, I'm sorry, but when you develop body rocking and tardive dyskinesia, involuntary mouth movements and stuff, but you're marked. You are openly mocked by children. You as a man, you are unattractive to women with these movements, right? So it fucks your life. And then it wreaks metabolic havoc. These medications, the antipsychotics, like, dude, I think 3-4 times in my life, I've gained 40-50 pounds in a couple of months. I have the stretch marks to prove it all over my body. I have pictures over the years of me just being ballooned up. I'm not naturally a big guy. I mean, I am a big guy, but not large, not obese or anything. But I have pictures of me where I'm like obese. And that's just not me. Right now I'm about 205 pounds, or I don't know, what is that, 92 kilos or something? I don't know. Somewhere around there, 92, 95, I don't know. Anyways, it's just 4 or 5 months ago, I weighed about 250 pounds. Interestingly, I dropped all the weight when I went off all the psychiatric medications. And amazingly, for the first time in my adult life, I am sub-threshold for clinical levels of depression. Oh, what the fuck? I allegedly have bipolar depression. Well, I am treating my bipolar depression and various other chronic conditions like chronic fatigue, hypersomnia, orthostatic intolerance when you stand up too quickly and you get lightheaded and dizzy or even faint. I've ended up in the emergency room from hitting my head from falling so hard. And got staples. Anyways, and what other problems? Okay, there's then there are lipid problems, okay? There's hyperlipidemia, okay? That I have consistently have had elevated cholesterol since my mid-20s, likely from antipsychotic medications, okay? So we got the weight gain with all the body marks and stuff and all the damage it's done to my internal organs. We got the fact that I'm going to I don't have a long lifespan because my cholesterol's a mess, even though it never lowers when I'm actually active and fit and I'm eating well and healthy. It doesn't matter anymore. The medications have done long-term damage. And then there's the body rocking and the tardive dyskinesia. So now I look like I'm mental. Before I could at least, kind of blend in, but now it's like, look at that guy. And I don't have control over that. Well, that's discrimination, guys. That's discrimination. Would you walk down the street and make fun of somebody for the color of their skin? No, because they don't have control over that, right? And that's racist. That's discrimination. Well, the same is true when somebody is a victim of our psychiatric system or our mental or our healthcare system and has developed long-term consequences. Not side effects, guys. Consequences. Okay? Severe consequences from these medications. And so, I've been on the merry-go-round, and I place my faith in Western medicine and psychiatry and everybody else. Neurology, sleep specialists, and dermatology. What'd it do for me? Nothing. Well, we don't know. Urologists. It's just like, they've got no answers. Well, you have all this education, you're being paid all this money, you're specialized in these things. Well, why don't you have any answers? And why don't you have any effective treatments? When I found it on my own. That I did the homework and I heard reference to this supplement that has neuroprotective, antioxidant, anti-inflammatory qualities for the brain. So, mind blown. So all these chronic conditions go away. Doesn't come with any terrible side effects. This is something, luteolin, it's something that occurs, it's a flavonoid. It occurs naturally in vegetables, peanut shells, things like that. But apparently you can't get enough in your diet. So, when you get a supplement with the right bioavailability and stuff, well, then it can penetrate the blood-brain barrier and help with all of your neurologically based problems. Neurologically based problems that are all likely due to pathogenic causes that are denied by modern medicine. So now I've already listed off the long slew of side effects that I've had from psychiatry. And this has been over the course of 30 years, guys. 30 years that I placed my faith in psychiatry and Western medicine. And what they do for me. And where are they now? And then doctors have the audacity, they got the balls to blame me for my cholesterol today. What? Are you serious? You need to exercise more. You need to eat better. No, you should have never given me those medications. All right? And I'm sorry. But, when you're putting on a pound a day, you don't realize it when you're sick and you're depressed and you're sensory numb and you're just a zombie. Well, there are those side effects too. They numb out your senses. They numb out your emotions. And what benefits have these medications given me? Well, they've never helped my mood. I had treatment-resistant kind, right? Meaning that, well, they weren't targeting the right thing, all right? They were ineffective. And a supplement, a flavonoid that occurs in vegetables and such. Well, God gave us a lot of great tools and resources, But, but the pharmaceuticals don't profit off that. The doctors don't profit off of supplements, And supplements are highly taboo, just like parasites are highly taboo. And and it's all bullshit. It's all about money. It's all about greed. It's all about power and control. It's all about keeping people sick long term. And then, after I developed tardive dyskinesia, my psychiatrist is like, well, there's this great new medication to treat tardive dyskinesia. So, okay, so you're telling me I took a medication that I shouldn't have taken. I developed these catastrophic side effects from this medication, and now you want to put me on a brand new medication that's not well studied to treat the side effects, consequences from the medication I should have never taken. And then you just want to play pile on, and now I'm on a statin for life. And, And now it's just like, oh my God, it never stops. Once you have one chronic condition in this system, it just boom, 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 boom. And you know, I had private health insurance most of my life, but the past 2-3 years, I don't know, I've been on Medicaid. 3 years, I guess. And boy, once you get on Medicaid, man, it's like, forget about it. Like, no. First of all, you're a second-rate patient, right? And you are treated as if you are fortunate to receive a doctor's time that you can talk to them. And how dare you actually ask them questions or ask them about your treatment plan or things like that, because, well, that's just crossing the line there, guys. You know, like, don't question the doctors. You didn't go to medical school, so you're not allowed to ask questions or have an opinion. No. You know your body. You know your mind. You know when you're healthy. You know when you're sick. And I don't care how much education and what letters are behind these people's names. They have not walked in your shoes. And they don't think twice about the side effects that come from these medications. Oh, and then there's coming off the medications. And then you grow a dependence, okay? They are addictive, okay? You can't just stop cold turkey. Even antidepressants, you can't stop them cold turkey, man. You get brain zaps, and you're just like, you can do serious brain damage from that. And lifelong antipsychotic use, you know, is akin. It does so much gray matter damage. It's akin to a frontal lobotomy today. So essentially, we are practicing archaic practices with ineffective treatments on ridiculous amounts of people. And then the people are treated like they're at fault because they're not getting better. What? You have, first of all, you're not identifying the core issue. Second of all, you're prescribing poisons. And then you're going to blame the patient rather than the broken system. That rather than, well, either the oversights of medicine or the limitations of medicine, or, I hate to say this, but, you know, the malicious intent of medicine. Okay? Because there are many questionable clinical practices. There is bad science that is rampant in modern medicine today that goes unquestioned. Why? Why? Because if we had a system of integrity, people would be calling out the bad science. Like, I'm no genius, I'm above average intelligence, but I figured out bad science. All right? That goes unchallenged. Well, I'm not the first. Well, why is nobody challenging it publicly in positions of, you know, influence? Huh. What's the motivation? And where's the money? Follow the money. Follow the power. Follow the human inherent need for greed and ego stroking, right? And narcissism. Where are the narcissists in our society? Huh? Where are the narcissists in our society? Who are they? And, you know, boy, you know, it's funny because most people who have like PhDs and just as much education as a medical doctor, most of them don't insist that, say, you must call me Dr. So-and-so, right? Well, most of them will be like, no, man, I'm Bill, you know? I'm Tom. Nice to meet you. I mean, in certain circumstances, whatever, you know, doctor, whatever, you know, but for the most part, you know, it's there's not that ego stroking and being like, you must address me by doctor. Well, that's just feeding into the ego of the system, and of a broken system, of these narcissists that have ineffective treatments, and then they blame their patients when they don't get better. The society, the system, and then they don't care about the long-term consequences. They don't care about ripping you off too quickly, rather than tapering you off medications. No, they don't. You know, it's, did anybody else see problems with our system here? Mental health and our medical system? And then there's a question of the integrity of our diagnostics. Because I can tell you, ova and parasite labs are bullshit, all right? They are not identifying properly parasites. They're just not. When you take a stool sample and take it in, and if you haven't been outside of the United States in the past 5 years, you're not going to get a parasitic infection diagnosed, except for maybe a couple rare ones like Giardia or something. But even then, you got to be pretty fortunate to get one diagnosed. I've proven, and I've had remarkable clinical responses. I have documented and proven the parasites that I have been infected by, and I've had remarkable clinical responses to parasitic medications, anti-parasitic medications. Ivermectin, albendazole, praziquantel, okay, to name a few. I've had, I don't want to go into every single one I've had, but the system's broken. And here I am in Chicago, Illinois, on the North Shore, and these pharmaceuticals, not only are they getting away with murder, and they're advertising everywhere, and they control the media because well, they're paying big bucks for these advertising slots, so they get to control what's said and what isn't, right? What is televised and what's not televised. Well, that's fucked up. We need to take television advertising in general, away from medicine, okay? For pharmaceuticals or anything that's profit driven, okay? We also need a diagnostic process where there's more validity to it, right? Where you can be certain that your results are accurate, right? That you're, everything matches up, because it's not matching up right now. So, if they don't check that little mark that you've been outside of the country in the past 5 years, and when you get an ova and parasite stool lab, you're not going to test positive for parasites, guys, even if you have them. And, but if all patient identifying information was stripped from all diagnostics, and various parasitic infections were planted into the general population of the testing every now and then just to keep people honest, and the people in the lab had no idea who was who and whose stool was whose and what their history was, and what their symptoms are, well, then we could have integrity in our medical system and our medical diagnostics. And I think many doctors are good people, but they're fooled because they believe in the integrity of our medical diagnostics when they lack integrity. But then there are the asshole doctors who are making the policies and procedures, who are very well aware that we are denying infections that are legitimate. I had a clear parasite here on my cheek, where I went into the emergency department. The guy diagnosed me with, or put on my thing or whatever, my discharge paperwork, delusional parasitosis. But what the gem was, is that this was at Presbyterian Hospital in Albuquerque, the main one. The gem of it was, he pulled out his own personal cell phone. He's like, "Can I take a picture of your cheek?" I'm like, "What the fuck, dude? Are you fucking kidding me?" And he had this smirk on his face. "Oh yeah, you're just delusional." But he could clearly see this, and he's just like, "Can I take a picture of your cheek?" Oh, that's just priceless, guy. I'm glad you can find humor in my pain. I'm glad you can find humor in my pain. And I've had too much pain. I've had too much trauma. And why? Why? Because I've been denied my chronic conditions, and I've been denied proper diagnostics. I've been denied proper treatments, be it from depression to anxiety to brain fog to sleeping too much to being exhausted all the time. Okay, these are all symptoms of chronic untreated parasitic infections. People, orthostatic intolerance, all the gastrointestinal issues, right? And, GERD, acid reflux, boom, went away from ivermectin, the anti-parasitic. generic medication. 3 days on that, boom. I was going to have a hiatal hernia surgery on Medicaid that the taxpayer was going to pay for. And it wasn't necessary because I had an underlying parasitic infection that was denied. And here you can see on top of my nose what's going on. That's a fucking worm, people. Huh. And, and this is when my face looks good because I've been on antiparasitics because I got them from India. Because I can't get them in the United States because it's too taboo. You don't prescribe ivermectin and albendazole in the United States or praziquantel. No. You have to buy them from countries where they actually admit to parasitic infections. And so, everything from tapeworms to strongyloides to hookworms and like, my God, people, it's, the system's broken and the pharmaceuticals are broken. And, I'm right next to a Pfizer, which, is or was the manufacturer of Geodone, which is one of the medications that made me balloon, really big, screwed up, my cholesterol and my metabolic markers, right? And alprazolam, which is Xanax, right? Where there, how many people are hopelessly addicted to benzodiazepines today? Because doctors prescribe them. Well, you're not supposed to prescribe them more than 2-3 weeks. Doctors prescribe them for years, if not decades, to people. That's abuse. You're making people addicted, and you're denying that they're addictive. And then you'll just, when your patient's not compliant, you'll just rip it away from them, and make them go through seizures and shit potentially. And benzodiazepines, you can die from the withdrawal. You can die, fatal. Alcohol and benzodiazepines are two of the drugs that you can die if you are chemically dependent on them, right? If you have a biological dependence. Does that stop doctors from just ripping you off? No, they don't give a shit about you. They give a shit about their pocket. They give a shit about their ego. They give a shit about being called doctor, right? And how are you doing with chronic illness? How are your loved ones? How many medications are you on? How many medications are your loved ones on? And are you getting better? The more money we put in this problem, are things getting better? No. And why aren't these problems being properly researched? We keep on pushing the dopamine and serotonin hypothesis, which is crap. It's total crap. And the system's crap, and there needs to be accountability, and there needs to be more valid and comprehensive medical diagnostics, and doctors need to be accountable for when they lie to you. And they should not be defensive when you ask them questions, appropriate questions about your medical diagnostics or your treatment plan. But some do, some do. And, there are a lot of good doctors out there, but there are a lot of terrible ones too. That got went into medicine for the money and the power and the influence. Okay, they didn't get in it for patient care. They don't care about you. Those and the ones that do, they carry a heavy burden because they gotta pull the slack for all these narcissistic assholes out there. And try to do a better job because everybody else isn't. I mean, the system's broken, guys. It's broken. So, here in Lake Forest, Illinois, let's go check out Pfizer. See what they're doing over there, huh?